we attend to the care of the family in conjunction with the care of the patient. Generally, they're inseparable. It's very rare that we will have a patient here with no other concerned parties. And it's as important for us to meet the needs of the patient's family and friends as it is to comfort the patient themselves. It's important to get the patient's wishes and the family's wishes for care to be congruent. Sometimes there are family members who want to have the person go down with all guns blazing and exhausted every possibility, even when it's a noxious event for the patient. We have to get those folks to come to realize what the patient's wishes are and what the reality of the situation is. I at times wish that I had the authority to prescribe medication for families, but we don't. The most potent tools that we have to help families is to put things in perspective and explain things to patients, families, and the patient themselves. It's not a rare occurrence to have a family come down and ask to hear my view of what's happening and what the prognosis for their loved one is. And I'll sum things up in layman's terms after having reviewed the chart and talked to our nurse liaison who's looked into the case up at the hospital. And very frequently, the families will respond, nobody ever told me this, or nobody ever made it make sense the way you just did. And that's in part because I have a knack for putting things in understandable language and putting things in a logical sequence. But more often it's because when they've heard it in the hospital, they've been under such emotional duress that they are deer in the headlights, who can only have a tunnel vision focusing on one matter at hand and not be able to get the gestalt or the big picture of what's actually occurring to their loved one. When they come to the hospice house, it's an entirely different atmosphere. Walking into the building, I think, allows the families to decompress a little bit, to just take a deep breath and relax a bit. It's meant to invoke a home setting. It's also meant to express to the patient and the family that their loved one or themselves are truly cherished and will be cared for in a most concerned and manner, and that will bring any resource necessary to bear to make them comfortable. So once that degree of decompression or relaxation occurs, the patients and families' panic response ebbs, and they're able to listen and integrate the information into the present circumstance. It's not that I'm a particularly unique individual. I think we're working in a unique setting that allows us to make sense for the patients. So information and understanding is a tool that's useful in caring for the patients. Also, gaining their confidence that their loved one will be tended to in a manner that's in line with what their expectations are. We are, first and foremost, a Catholic mission, a mission of the Sisters of Bon Secours, and they are reassured that every life matters intensely to us and will be treasured and cared for as best we possibly can, and that we don't ever take means to purposely truncate a person's lifespan. Sometimes we have to intervene with medications that are very aggressive in order to control symptoms, And the result of that may be that the hours that that person continues to breathe are abbreviated somewhat, but the intention is never to do so. The intention is always to address the distress of the patient and do what's necessary to relieve it.